More now on the health insurance price hikes from Rachel Blair, the Chief Strategy Officer at the Health Alliance for Austin Musicians, an innovative nonprofit that helps people in the local music community access health care. Rachel, thanks so much for being here.
Thanks for having me.
Rachel, you and your team are very well versed in the ins and outs of the ACA. What impact are you seeing from cost increases so far this year?
Costs in the ACA have definitely increased. Our musician members are feeling that. We are here to help them and walk them through the complicated changes that have come this fall.
And your work, like you said, specifically focuses on helping our music community. But this problem is, of course, broad-based.
That's right.
According to data from a coalition of advocates called Keeping Americans Covered, in the 2 congressional districts that include Austin, more than 154,000 people receive these tax credits. So in simple terms, how do these tax credits work, and what are the consequences if they're not extended?
Tax credits offset monthly insurance premium costs. So if your insurance costs $1,000 a month and you are at 150% of the federal poverty level, you might get $850 off of that monthly insurance bill last year, or in the plan year 2025. In 2026, the tax credit that reduces your health insurance premium is going to reduce, making your premium go up. Not only that, insurance companies have increased the premium prices. So we're seeing anywhere between 15 and 30% of premiums increase, and as well as tax credits going down, which means more money out of the pockets of people who really can't afford it.
So what happens for these people if these tax credits aren't extended?
For HAAM members, they get to come through our open enrollment process. We have trained navigators through our partners with Foundation Communities and our own staff, and we really walk people through these plan choices. Everyone, as they're picking an insurance product, has to try to figure out how much am I willing to pay and how much can I pay every month for a premium, and then what are my costs inside my plan. So picking deductibles, co-pays, co-insurance, and whatnot. You've got to be able to afford your premium, though, and that's the trick with the tax credits where they are now. And just to clarify, during COVID, there were increased tax credits to help make insurance premiums be more affordable. Those were set to expire at the end of this year without them being renewed. So we're not talking about all tax credits going away, we're talking about the enhanced tax credits going away. But between the enhanced tax credits going away and the rising premiums, consumers definitely have sticker shock.
What is your biggest concern right now? It's a pretty complicated situation for many. Are people going to end up without coverage? Are people going to have to make really, really tough choices between insurance and food and shelter? My biggest concern right now during open enrollment is that people will hear these messages about increased premiums and self-select out, that they won't go through the enrollment process and they won't see what's available to them. So while there are steep increases for some, there are also tax credits and affordable premiums for others. So typically the less you make within the ACA, the more help you get. And that's true this year. So we really, really want to encourage people to come through the open enrollment process. If you're a musician, come join HAAM. We will walk you through it. We have wonderful, friendly folks who are experts, who are really skilled at taking something complicated and distilling it down to its simplest essence. If you're a community member and you're not a musician, you can go to Foundation Communities or other places. You can go to the healthcare.gov website and shop around. We really don't want folks to go uninsured next year without doing their research first. It's so great to know that there are organizations like yourself that are helping our music community and others, because there's so many people in this situation. Rachel, HAAM's role in supporting the people who make up our music scene is a vital service to Austin. Thank you so much for sharing your expertise on the ACA tax credits.
Absolutely.
Thanks so much for watching. Be sure to like and subscribe and leave us a comment below to let us know your thoughts on this video. And don't forget, you can watch full episodes of Austin Insight for free in the PBS app.